Immunisation has been around for decades, and it's still our most potent weapon in improving public health. But it seems that every year there are more and more infections threatening widespread illness. So what can we expect from immunisations in the future? I asked expert Professor Terry Nolan from the University of Melbourne what new developments look interesting.
The most interesting area for vaccines is looking for vaccines that will prevent not just against infections as we know them, but also against cancers that may be caused by infections, or cancers that may not be caused by infections, but where a vaccine sensitises the immune system to resist the development of a cancer. So in many cancers there are different research streams and programs going on at the moment to try and target those. We have 2 vaccines already that prevent cancer that we're currently using. The first was the hepatitis B vaccine, because the hepatitis infection causes liver cancer. And so preventing the infection will actually prevent liver cancer, and we've been using that now for 30 years. And the most recent one, which is the human papillomavirus or HPV vaccine, causes cancer in women, cervical cancer, or in men, and that vaccine will prevent cancer as well. So this is an area for the future which is really important.
Deep breath in.
Human papillomavirus, or HPV, is best known for causing cervical cancer, but it also causes oral cancers, especially in males. So why aren't we immunising boys?
There is a debate still continuing about whether publicly funded programs to immunise boys should or should not happen. We now know from recent evidence that the vaccine does prevent cancer in young men, and we also know that it can reduce the circulation of the virus to protect girls who've not been immunised. So the debate is around whether it's cost effective to do that.
Even if governments around the world are deciding not to fund this immunisation on the basis of public health, doesn't mean that parents shouldn't be considering whether or not their boy would benefit individually from having the HPV vaccination. Especially at a time when more cancers are being identified as being related to HPV.
It's a very interesting story that people may not be aware of. The cancers of the tongue are caused both by tobacco and alcohol, and also by the human papillomavirus. Those that are caused by the human papillomavirus have been increasing in frequency since the 1960s, whereas those that are caused by tobacco and alcohol have actually been declining as we've been able to reduce population levels of exposure to tobacco in particular. It is a concern that that increase is occurring, and fortunately the vaccine should prevent those cancers as well, provided individuals are vaccinated before they're exposed to the virus.
So if you'd like more information about HPV vaccination, go to the Tonic website and follow the links.